Are your hip flexors and quads creating hip pain and low back pain? Today we're going to break down what's called the modified Thomas test. We do this test with anybody that has knee pain, hip discomfort, or back pain. So for the setup, we're going to lay on the edge of the table. We're going to tuck this leg in until the low back is nice and flush or in contact with that table. And then we're evaluating some angles of this free leg here. So the hip flexors and the quads are two separate muscle areas. When evaluating the hip flexors, if Rory's thigh is elevated up above the table, it's a sign that the hip flexors are too tight and they're creating this elevation. So what we're looking for is a nice parallel line or even below parallel to healthy hip flexors. Now the quadricep muscles, the muscles that will go all the way down to the knee joint, if these are tight, we're going to have extension of the knee. So with the knee, we're looking for a 90-degree angle. A 90-degree angle at the knee joint will let us know that the quads are at a proper length and they're not too tight. So again, if we're out here, this can easily be causing some knee pain, some hip pain, and whenever we're too tight in the quads or the hip flexors, it'll always hyperextend the low back, creating joint problems in the low back. One last thing with the modified Thomas, we're also looking at the leg to make sure it's in proper alignment from the hip to the knee. So if it's angled out to the side, we might have an IT tightness issue. If it's angled really far to the inside, that might be adductor tightness or glute weakness. So these are a bunch of things that we're looking for in the modified Thomas test.